Hi everyone, we're going to be talking about nursing delegation. Nursing delegation is an important part of nursing if you're going to work in many different settings, including the clinical setting. Chances are you're usually going to have LPNs, CNAs, and other RNs working with you, and you need to be able to appropriately delegate tasks to them. The 5 rights of nursing delegation are pretty easy. It's the right task, right circumstance, right person, right supervision, right direction, and communication. We're going to break down all of these and give examples of what it means to delegate different tasks to different people. So the right task, you need to ask yourself, is it legal, and what are your organization's policies? For example, a CNA can check glucose levels, bathing, and personal hygiene for patients. LPNs can change wound dressings and insert Foley catheters. RNs are able to administer IV medication and blood products. Is the outcome predictable? For a CNA, checking routine vitals, an LPN giving oral medications, and RNs will be in situations that are less predictable. So what I mean by are they predictable? For a CNA, you would want to give them, ask them to check vitals on someone who's been relatively stable, that you don't expect anything crazy to be happening. Or for oral medications, you want to make sure that it's their usual morning or evening medications and not something that they're taking for the first time. If it's something that may be less predictable, you would want an RN there to be able to assess the situation. The right person. So each state is different as far as what each level is able to do, but it's also important that you know whether they're properly trained and educated on how to do it. So for example, a CNA, you could ask a trained CNA to check glucose levels on a stable patient. You wouldn't want to ask someone who's not comfortable or has never done it before without teaching them how to do it. For an LPN, you could ask a trained LPN to draw labs on a patient. Again, you'd want to make sure that they are properly trained. For an RN, you could ask a trained RN to record during a code situation or stroke situation or something like that. The right supervision. So ultimately, the RN doing the delegation is responsible for the entire act. So for example, the RN would need to ensure that the glucose is charted that a CNA did, or that the LPN charted the medication that he or she gave, and that you could ask an RN to waste a high-risk medication with another RN. So what I mean by wasting is a lot of states, including my own, you have to have a double eyes on high-risk medications such as opioids, but you have to have another RN supervising this. The right direction is basically the who, what, when, and where. This is just being very specific in your directions. For example, a CNA, you could say, will you check Mr. Smith's temperature in room 25 and report it back to me at 6:30? This gives a who, what, when, and where. An LPN, you could say, will you give Mr. Smith in room 25 his evening medications at 5 o'clock and document it? An RN, you could say, will you be my second sign-off for Mr. Smith's blood products right now? This is saying exactly what you need, where you need it, and when. This is very important when giving directions so there's no confusion. You can find your state's laws of delegation and nursing skills in your state nursing Practice Act website. Here's the website right here. These are the references that I used if you would like to look any of them up. Thank you, and I hope you learned something about delegation.